Hi everyone, my name is Brent Smith and I'm a physical therapist at Hospital for Special Surgery. Today I'm going to teach you some exercises to help prevent injuries of your knees. So the first exercise for today is the single leg glute bridge. I like this one because it helps selectively engage your glutes, which for a lot of runners are either weak or they don't know how to engage them. You commonly find with knee pain, it comes from having imbalances or weakness in other areas of our body, such as the glutes. For this one, we're going to extend one of our legs out in the same plane as the other thigh that's on the ground. That way we can selectively engage the one glute, obviously attached to the foot that's on the ground, and lifting up from there. We want to keep our spine nice and neutral, no movement or rotation through the pelvis. Lifting the buttock up off the ground just so that your torso and your thigh are in alignment. I would suggest doing 10 in a row on each leg, one set. As you become stronger, you can add more sets up to 3 on each leg. Don't forget to do each leg. So the second exercise I'll be showing you is the side plank. So by having a strong core, we help unload our other joints and keep them stronger in the long run. So a standard side plank is having your elbow underneath your shoulder. You're gonna lift up through your side body until it's in alignment with your thighs. You have 2 choices here. You can hold it there for as long as you choose, or you can slowly lower it back down and lift up again, doing 10 repetitions in a row. For those of us that find the arm up in the air to be too hard, you can place your hand on your hip. As well, if our legs being all the way out is too difficult, we can come down onto our knees, which should make it easier. So in terms of repetitions, I would suggest doing 10 in a row. You can start with 1 set, and then as you get stronger, you can work your way up to 3 sets of 10, for those of you that are doing repetitions. If you choose to hold it in place, work your way up to holding for 30 seconds as a good baseline to start. So for the third exercise, we'll be demonstrating the lateral step up. This is gonna help strengthen the hip stabilizers so that as you're running, your hips don't have a tendency to drop. These hip abductor muscles tend to be muscles that are very weak in a lot of individuals. Now, of note, we're demonstrating on a bench that is definitely too high for this exercise, or will be too high for most individuals. So find a step that's approximately 4 to 6 inches as a place to start. When you're doing this exercise, make sure that you do not drop your chest forward. Keep it up nice, tall, and proud. And as you step up and down from the step, make sure that leg that's not supporting you always steps down to the side, not in front or in back. When you do this again, I would start with 10 repetitions, 1 set on each leg. And as you feel stronger, you can add extra sets of 10 repetitions up to about 3 sets. So for the fourth exercise, we'll be demonstrating the Bulgarian split squat. I like this one because it engages the ankles, the knees, the hips, even the core. I also use this one quite often as a dynamic warm-up before my runs or before any races. When you do this one, what's most important is that leg that's in front. Do not let the knee move forward over the toes. Keep your shin, your lower extremity nice and vertical with the ground. Keep the chest up high, the core engaged. And most often, you'll have to adjust that back leg that's on the chair or the railing to find the perfect position so that you're able to go straight up and down. If you need a little more balance, you can point your foot, unlike in the video, so that you have more surface contact to help maintain your balance. As a repetition prescription, I would say do 10 in a row on each leg. And again, you can increase the amount of sets that you do. So these 4 exercises are to help strengthen your knees, but they're actually to help strengthen your overall body to help prevent knee injuries. I hope everyone out there finds these exercises helpful. My name is Brent Smith with Hospital for Special Surgery. Happy running, everyone.